It is a crazy story.
Yeah. It's just one of these things, it's like I'm seeing a pattern with these people here. It's kind of crazy.
What kind of pattern?
It's just
uncaring.
Yeah, they just kind of go to the extreme with all of these things. I'm like, okay, so another one that has like found a loophole somewhere to take advantage of people.
I'm starting to read that these people actually think these people are heroes, like they're clever.
Yeah. And I'm like, really?
Right. Right. I mean, I don't know. Just like you said with Anna, if they're scamming the rich, it's a little harder to be mad about it.
Right.
But when they're scamming old people, let's get into it.
Yeah. All right. So this one today comes to us from Houston, Texas. And before we get too deep into it, I just want to put a disclaimer out there that this Mohamed Mokbel, I think I said his name correctly, he has allegedly done this crime. So he hasn't been formally like charged in court yet.
Yes, he has been indicted.
Right.
So that is a formal judgment, but it's not really. He's still presumed innocent.
Yes, until proven guilty in a court of law. So here's this alleged story. So basically, this guy's a pharmacy owner, and he has this accountant with him who's also been charged with a bunch of variant things that we'll go over. And it's basically a $134 million healthcare fraud scheme.
Whoa, that's a big one.
I know. It's another big one. I love to, when I'm out fishing for stories, I like to get the big ones, reel them in.
Yeah, go big or go home, right?
That's right.
You're going to scam people, might as well scam $134 million.
Yeah. So the guy, his name was Mohamed Mokbel. He's 56 years old. His accountant's name is Fathy ElSafty, 62-year-old guy. So they're, a little over mid-age here. So Mokbel is an owner of several Houston pharmacies. And Fathy is his accountant for all of it. So the company is called 4mm or 4M. I guess we'll just say 4M. I don't know if that stands for millimeter or not. I mean, 4M, whatever. Maybe it is a millimeter. I don't know.
Yeah, right. Ooh, sounds like it probably is a millimeter.
Right. 4M Pharmaceuticals Incorporated is the company name. So what they did basically was they had an outbound telemarketing call center that would call, those annoying calls that you get on your phone and you're just like, I'm going to kill. Why are these damn people calling me? I pay for this, Right. Anyway, so this call center that solicited Medicare, Medicaid, and commercial insurance patients nationwide. So, yeah, they would call many people over the age of 55. So obviously they're targeting the senior citizens, which we all, that's like the dirtiest crime ever, right?
Mm-hmm. Except for little kids, maybe.
I know. I'm like, those are like the worst, old and little kids.
They're called vulnerable populations.
Absolutely. The call center employees offered patients medically unnecessary diabetic supplies and topical creams. And then even though many of these patients refuse the solicitations, 4M billed them insurance companies anyway. So if you can imagine, it's like, I don't know how many people, I don't know how Medicare or Medicaid works because I've never been on any of that and I'm not old enough from the Medicare. So I don't know if because I'm just trying to figure out, because this crime went on from December 13th of 2013 to March 3rd of 2020. That's a long ass time for that.
Yeah.
And to me, it's amazing that they had not been caught before this, and I don't know if the Medicaid or Medicare patients, if they look at their bills ever, because it's basically free healthcare, right? So I don't know if you get bills for that or I just don't know how that works.
Medicare is the one for the elderly, right? And Medicaid.
Yeah.
Okay. Well, Obamacare, whatever, they expanded it in the States. And so at a point where I was laid off from a job, I got on it because you're required to. And from what I remember, there's no bills. You don't see anything. You don't have to pay for any of it. I'm trying to remember what I did. We did quite a bit, but I don't think there's any bills. So I think it makes sense that it might be kind of easy because they wouldn't know they're being charged for these things.
Oh, okay.
especially
Yeah.
if, yeah, I mean, I don't know what he was giving them, like, was he charging them for the little pricker things, or was he charging them for the little, I don't know. There's
Yeah,
all the tools
probably.
that you
I'm
need.
sure. I'm sure there's a ton of stuff that you could get away with billing someone for diabetic supplies because there's just unfortunately so many things that if you are diabetic that you need,
Yeah.
to take care of yourself on a daily basis. So I'm sure it was like all that kind of stuff, like the insulin monitors, things like that, or the test kits that you have to do every day, all that kind of stuff. So I'm sure all that is what he
And
was billing them on.
was he not sending it to them either, or was he just
Well, he would send,
overbilling it?
he just overbilled it. And I think
Okay.
he just sent it to the ones that wanted it. Like he would send it to them. But
Mm,
then the ones that refused, he went ahead and just billed it anyway, but didn't send anything. And then it didn't matter because like the person, he probably just got their information, through the call center, right? Like on the phone.
yeah.
And then they just went ahead and billed it through whatever insurance company. So it gets even crazier as we go along here. So in some cases, they actually billed patients that were dead as well. Like
Oh,
they
geez.
somehow got away with that. Because, I know in the medical records side of things, because I'm in the medical field, medical records, I think it's like 4 to 5 years they keep them. So even after you're dead, they're still going to have your records for like 4 to 5 years. It's kind of
Sure.
like, taxes, like after 7 years type deal. So that's
So he would
probably,
still have access to their names,
yeah.
and then he could just continue to bill them. And if they hadn't cleared their rolls or whatever, then
Right.
the Medicaid, the state or whatever. Interesting.
Yeah, it's so interesting. So then on top of that, he didn't just target the patients. He was also targeting the doctors' offices and the doctors involved. They would send faxes to request the prescriptions that doctors did not authorize. And then they would just bill the patients for prescription drugs without a valid prescription and sent requests to the doctors for even after the dead patients too. And that's what blows me away about this is like, how do you not get caught? Like as a doctor, you would think that there's someone in the office that oversees all this kind of stuff coming in or out, right?
You're right. He just knew those loopholes.
Yeah,
For
like
10
just totally.
years. Yeah, that's crazy. We all know loopholes in our field. It's just a matter of whether you take advantage of them.
Right.
These are crazy loopholes.
Oh, 100%. So then Mohammed, he's raking in all this money, right? Because like he doesn't have to produce all these products or, send all these real drugs to anyone. He's just getting money from all the insurance companies coming in to his bank account, right?
Mm-hmm. No one's the wiser.
Right. So, and then
Victimless crime.
yeah. So then he just has like the accountant go in and like kind of doctor it all up there. Now, allegedly, all this happened. I just want to say allegedly for right now.
Right.
But this is kind of the story of what was going on here.
Well, we'll find out more in court, I'm sure. I'm excited.
Oh, yeah.
For the court.
Yeah. We'll have to do an update once the court proceedings continue with this case. So the other thing is like, so he's living in this, I'm not sure what part of Houston, but it looked like a fairly nice neighborhood that he was living in. He had a $2 million house and he bought like Ferraris, like his neighbors referred to him as like the Ferrari guy. So, just like one of those like people that, just flaunt all their cash everywhere. You kind of know that those are the fakers, right? When they're doing stuff like that.
Well, and people think, oh, he owns his own pharmacies. He's a millionaire, at least. I mean, it makes sense. He's good with his money, buys some cars. He also had like 15 million in gambling debt or something like that.
Oh, yeah. So he's going to the casino, flaunting his money, probably going out to Vegas, buying all this crazy stuff. Like his neighbor said they had to call the police on him all the time because he was throwing these wild parties at his house.
Wow.
Yeah. So the Ferrari guy.
Yeah.
I think that should be the headline for this, the Ferrari guy.
The Ferrari guy. Ew.
So, and apparently, I mean, he's been at this since like the 1990s. And that's the other thing you notice with all these people, they have a background in this criminal activity before like their big, huge crime that they do.
Yeah, of course. I mean, it seems to me a lot of the cases, they don't end up having to pay it all back. Somehow they end up getting out of it. So
right.
They kind of think, oh, well, it's worth it, to spend a few years in jail. You don't have to go to jail for that long. This guy only has a 10-year sentence minimum, maximum 20. And
wow, I thought it was more than that.
Well, according to the indictment here, all carry, for the things he got charged for, all carry, maybe he could possibly get 10, but all carry a possible prison sentence of 10 years in prison and a $250,000 maximum fine. The use of telemarketing to target people over 55 as a means to commit healthcare fraud carries an additional penalty of 10 years, but a minimum of 10.
So that's all he's going to get, possibly, is 10. If he's found guilty, is 10 years.
I think it should be a year per dollar.
Right? Right?
134 million years.
Right. I know. And, when they raided his mansion, they found $100,000 worth of casino chips, $32,000 in gift cards, and then numerous bank accounts and details of a 12-story building in Egypt. So,
his escape house.
Yeah. I'm like, I guess you could escape to Egypt. I don't know. Maybe he has like a secret tunnel that he's having built under his mansion from Texas to Egypt. We don't know. like that one guy, the drug lord that they put away. What was it? Escobar?
Oh, yeah. Yeah. Gosh, I'm like, below? What is his name?
Yeah.
Well,
so
I'm excited to see how this thing turns out. I mean, in looking for people who had been victimized by him, there weren't any because people have to come out and they don't even know, probably, that they've been
they're probably
overbuilt.
Totally unaware.
So at this point, the victims are us as taxpayers because he frauded the system and we all pay into it.
Right.
I don't think anybody's going to personally be on the hook for any of this, and that's why he did it, is because he knew.
Yeah, he probably knew the consequences beforehand. And like you said, if it's only 10 years, that's not a whole lot of time for like something like this, which I think is totally insane. And currently he is on house arrest because they're afraid that he's going to be a flight risk, obviously. 12-story building in Egypt or whatever. But like
he's I guess drive his Ferrari up to Canada. Yeah,
probably. And, maybe he'll fly his Ferrari across to Egypt, but I don't know. I mean, so I guess the judge was a little bit more lenient with him because he has a small child that he is raising. So, which is, there's a victim right there.
Yeah, really. Well, he's on Twitter. I saw, he's posting.
Oh, yeah.
Like, all things are normal for him. Normal life, gets to sit at home with his nice 134. You watch, he will not have to pay all that back. He will get to keep quite a bit of it, I bet. They'll make him sell his house and stuff, but
maybe his pharmacies he'll have to sell.
Right. But he won't pay it all back. He probably has already set up, just as we've seen in a lot of these, some other accounts or something for other people or,
offshore. Yeah. Oh, yeah.
His Egypt place, because, it didn't happen there. So they're like, we don't care. Bring your money here,
Yeah.
This is why we have to get along with other countries so they extradite people back to the United States. Although some people, I'm like, oh, maybe you should stay there.
Well, he is actually an American citizen too, so I think that's why he was also granted the house arrest.
Otherwise, no, but I mean, like Snowden or something.
Oh, yeah.
Like, see you later. I'm gonna scoot out of here.
Yeah, I'm gonna go live in Russia.
Right. Well, that was a really great story, Mary Contrary. Thank you for sharing.
Yeah, absolutely. So that's the story currently of Mohamed Mokbel, and we'll be watching to see what happens to him in court.
Yeah. And if you guys hear any updates, let us know on Twitter. We also would like for you to let us know about any other stories about fraud, #fraud, or #Ferrari guy if you hear about Mohamed.
Thanks, everyone, for listening to Real Talk. Don't forget to subscribe to our podcast wherever you listen. We look forward to having you on our next one.